A beautiful afternoon to you, and glad to have you join us on the program Healthy Living with yours sincerely, Oluije Oihohai. On the 19th of April was World Liver Day. Now, World Liver Day is observed annually on April 19th to raise awareness about liver-related diseases and the importance of liver health. It aims to educate people about the prevention, diagnosis, and treatment of liver disease such as hepatitis, liver cirrhosis, fatty liver disease, and liver cancer. And to educate us today, to talk to us, is a person of Dr. Igbinosa Omo Okwasuye. He is the Senior Registrar, Department of Internal Medicine, Gastroenterology, Subspecialist, UBTH. Good afternoon, Dr. Omo.
Good afternoon. Thank you for having me.
Okay. Yes, on behalf of your unit, I think you have something you want to say.
Yeah, I want to say I bring greetings from University of Benin Teaching Hospital, Department of Medicine, and precisely Gastroenterology Subspecialty, headed by Professor Mwemu. We are here today to talk to us about the liver, the different diseases that are related to the liver, and how we can live with it and prevent where possible.
Okay, now for WHO to set out a day, 19th of April, to talk about liver conditions, liver disease, it brings us to focus that it's something very important.
It is.
It's something that we ought not to just trivialize. Now, first off, how can one know the symptoms of these liver diseases?
Most times it's what we call asymptomatic, meaning that there's no symptom at all. But that's our own terminology. But over time, when it becomes chronic, people may begin to have yellowness of the eyes. They begin to have altered sleep pattern. They sleep more during the day and less at night. It's also possible that they begin to have itching, and most times it's generalized. Some people may notice that their tummy, their abdomen is swollen. Their legs are swollen, and begins to gravitate from the toes, it gets to the ankle, from the ankle it gets up to the knees, and even probably beyond. And there are other things we see. There could be pain in the right side of the abdomen. These are some of the things that make persons to come to the hospital for checkup.
Okay. Now, they say early detection is key. How can one know that there's something wrong with my system? I need to go check what is exactly the issue. Now, how can one detect these things to be able to know, okay, I have to go see a doctor?
What we advocate, you don't have to be sick before you come to the hospital.
Okay.
So we advocate yearly medicals. So at least once in a year, go to the hospital and do a general checkup. Specifically for the liver, you do a liver function test and serum protein. You can also do an abdominal ultrasound scan. This on their own can pinpoint if there's a problem.
Okay. Now, from what age can someone start saying, I need to do, like you said, once in a year checkup, right? From what age?
Especially from the age of 40 and above.
Okay.
But before then, nothing is out of place to come for medicals.
Okay, so how is hepatitis B and C related to liver diseases?
Okay, I want to also say before we talk about hepatitis B that a lot of things can cause liver problem.
Yes.
You know, alcohol, infections, and out of the infections, there are viral infections. And the major ones, that's where hepatitis B and C come in.
Okay.
The others, viral disease, which we also know as HIV, can cause it. There are also other kinds of viruses that also cause it. It can also be bacterial infections, though the most prominent is the hepatitis B and C, then alcohol. Another very particular one is non-alcoholic fatty liver. So people just begin to have increased fat in their liver. These are the major things. But back to the major ones, which is quite common, especially in our environment, hepatitis B and C. There are several ways somebody can contact it, but basically being in contact or with body fluids from somebody who already has it. And it could be either through blood transfusion, which is quite minimal now, through sexual contact, unprotected sexual contact, through sharing of sharps. And when I mean sharps, I mean blades, nail cutters, and from the barbing salon and all of that. Needles, where they do their hair and all of that.
Okay. All right. Okay. Now, looking at the theme for this year, keep your liver healthy and disease-free. This year theme focuses on the need for regular well-being checkup, like Dr. Omar said, to prevent liver-related disorders. Now, when we talked about the symptoms. Now, you've talked about also the causes, alcohol and some other things. Now, fatty liver. For someone that doesn't take alcohol and eats maybe normal, we know in Nigeria it's all about fatty food. It's more of carbohydrates. Now, how does one get fatty liver or fats in the liver, like we will say?
Okay, several things can cause fat in the liver. You know, it can come from alcohol.
Okay.
Over time, due to taking excess alcohol, much fat is deposited in the liver. However, there's also the one we call non-alcoholic.
Yes.
And so that's another class of its own, and it's becoming increasingly common, not just in Nigeria or in Africa, but worldwide. Part of the etiology is not known, but it could also come with different liver pathologies, that's liver diseases now. Hepatitis B, hepatitis C, even the alcoholic liver disease and others, hemochromatosis and others. So once they are there over time, there's more deposits of fat in the liver, and there's fatty liver.
Okay. Now, someone will say, well, if I have maybe liver disease, will I start having pains in that region? You said the lower abdomen, right?
Oh, yes, the right side of the abdomen, right upper side.
Okay.
That's where
Can you just demonstrate maybe?
Okay. Well, people generally will say this is their stomach, but for we in the medical profession, this is the abdomen.
Okay.
Okay. We can divide.
When you say abdomen, so that a layman can understand.
The abdomen is below the ribs.
Okay.
Down from below the ribs down to just above
the
the
waistline.
To the waist, beautiful, the waist. So that entire region is the abdomen.
Okay.
You can divide it into 4 using the umbilicus, what we call the navel, from the rib down straight, and make it 4 regions. The right upper part, that is where the liver is located.
Right. Okay. Okay.
So, of course, initially there might not be symptoms or even pain, but over time, because the liver doesn't have pain receptors, but over time, due to the liver getting bigger, getting abnormally big, enlarged, you begin to have some pains due to the stretching of the capsule.
Okay. So is there a particular lifestyle that someone has to live and to prevent this liver disease and all of that?
Well, definitely, there's the lifestyle. Because once now the persons have not gotten it, we must, of course, live in a particular way. Then for those who have already gotten it, depending on the cause, we can also decide to advise accordingly. So for the lifestyle, we must avoid taking excess alcohol.
Okay. Like in a day, or let's say in a week, how many times?
Okay. Alcohols, the bottles differ. There are several bottle sizes, and the percentage of alcohol inside is also varied. Okay. But we're not talking of spirits now. So let's use the conventional one, let's say the Gouda or the Start. Okay. Let's say 1, 2. Just average of 1 or 2 bottles, minimum of once or twice a week. Okay. The advocacy is not to drink at all.
Not to drink
However,
at all.
if you cannot drink, you should drink as minimally as possible and give at least a day or 2 in between.
Okay, a day or 2 in between.
Yes.
All right. Because I know some men out there, they will be like, how many times am I supposed to take alcohol? And some persons are so addicted to these things, they don't even know how to, reduce or how to cut down on these things. I'm sure the way you have explained now, in a week, like 1 bottle.
Well, I'm not indulging anybody, really, because I'll give a little explanation. If we keep consuming alcohol over time, it begins to destroy the liver. And the end products. By the time somebody has chronic liver disease, after about 10, 15, 20 years, the fear is it can be transformation to liver cancer. And so because of that, it's actually advocated that abstinence. But as I said, if it's difficult to abstain, 1 bottle on the average, 2. At most once or twice a week.
Okay, abstinence is key anyway.
Yes.
Abstinence is key. Now, someone said, I did jot it somewhere. It says, healthy life is overrated. Now, when you're healthy, you don't know what you have gained. And when you're ill, then you tend to start seeing the world in a different perspective. So what would be your own method of advising people on how to go for a regular checkup?
Okay. I will also give my own to a healthy liver, you know, is a healthy life.
Yeah, sure.
Why I'm saying it, because the liver is just, is a very particular organ, just like the brain.
Yes.
You can't do without the brain. You can't do without our kidneys and the heart.
True.
Also the liver too, we can't do without the liver. If one is drinking, you stop drinking or reduce it. If peradventure you've had symptoms, we talked about some yellowing of the eyes, itching, swelling of the abdomen, of the legs, and all of that. Altered sleep pattern, you're urinating, your urine becomes like coke color, you know, all of this, and possibly vomiting of blood, you know, passing out stool in blood in stool. You know, you need to come to the hospital and keep on seeing your doctors. If all of this is not happening, then we'll talk about at least yearly medical checkup.
Yeah.
And once, of course, once the results are out, you must see a doctor who's able to interpret the results and advise you accordingly.
Okay. Okay. Now, cholesterol. I know that there's something about the cholesterol in one's body and the person's well-being. Now, how can one be able to manage the cholesterol intake on a daily basis? Now, we look at our normal food, our normal Nigerian African food. There's virtually no one that has that's not associated with carbohydrates. Look at rice, yam, fufu. So how can one cut down on cholesterol intake?
Cholesterol intake is actually something that cuts across all kinds of foods. That's the first thing.
Yeah.
And size doesn't determine, you know, the cholesterol levels in the body. We need to assay for it. You understand? However, the advocacy is eat balanced diet.
Okay.
Minus just checking for it, you know, using the blood assay. We should take balanced diet, and of course cuts across taking carbohydrate, protein, fat and oil, vegetables, you know, together, and spreading it across our meals. Exercising, you know, for those, especially those who are either overweight or obese, regular exercises too also have to take care of that. So my point is, it's not by the size, you know, that the cholesterol is high.
By the person's size, yeah.
Yes, it's high. Okay, we must assay for it. So some people would think that the bigger you are, you know, the more the cholesterol, it doesn't follow. So we check for it. But however, regular exercises, eating balanced diets, taking reduction. Actually, by the time we check and we assay and there's actually high cholesterol, taking medications, treating with medications and seeing your doctor are some of the ways we can actually help out.
Okay. Okay, so are there stages of this liver disease? Are there stages?
There are stages actually, but I won't want to bore you with stages. What I would just want to say is that once the liver begins to fail, it gets to an extent where we call it chronic liver disease, and from there could be liver, there could be transformation, and person can have cancer. Okay. Okay. Let's leave it at that. I'm saying this now for the general public. I'm not looking at the heads, the medical community per se. I'm talking even to the market women, those in the villages and those on the streets.
Yeah, yeah. Okay, now, in a layman term, now looking at hepatitis B and C, some persons might not know how it's been gotten. They'll be like, I'm okay, I'm fine. So how did I get it? How come about it?
What you just said now, it's what a lot of persons say when we see them in clinic.
Yeah.
I didn't do anything. How did I get it? But we asked, there are risk factors. Mention some of them. I talked about sharing of sharps, needles, blades, nail cutters, even tattoos. Yeah. You know, some people, they go to where they do tattoos, they use the same instruments that they use for others, they use for them. They might not know. A lot of people, the people we call abokis, they come, they cut their finger, their nails, and whatever. They use the same that they use for others. Some people go to the salons where possibly that those what are used, the clippers that are used are not sterilized or not sterilized enough.
Yeah.
But basically, it's coming in contact with fluids of somebody who is positive,
Okay.
and is effective enough to spread it.
Okay.
That is how it's gotten.
Okay. Okay. Now, sometimes when I take my son to the barbing salon, I see the barber doing the whole the fire and the clipper stuff.
Yes.
Is that thing? Is it okay? Is it enough? Is it enough to kill the germs or whatever that is associated with the clipper?
I would want to say that personally,
Yes.
I don't know if it's enough, because I'm not aware of any study that was done to actually
Ascertain
see the
fire
efficacy and
and-
all of that.
Yes.
What is advocated is that you go to the barber salon
With
your
your own.
clipper.
Yes. Yes.
So you, at least with that one, you know that
You are
it's yours.
certified.
Yes. Even for the same, for persons of the same appearance, everybody should have their own. It's better that way,
Okay.
and it's safer.
Okay.
But as I said, there are several risk factors. It's not just one thing that can lead to it.
Okay.
In fact, the mother too can also give her baby. So then siblings in the house, children in the house, one can have it probably from school or anywhere and spread it to the others. So there's no one single way that somebody can get it,
Okay.
besides sexual contact.
Okay, all right. So in a nutshell, looking at liver disease, now we have different types. So can you please elaborate or tell us different types of liver disease that we have?
Liver disease are varied, are several, but the very common ones are the ones I mentioned or we've talked about already.
Yes, yes.
On one hand, we have the non-alcoholic fatty liver disease, which people just call fatty liver.
Yeah.
We have the alcoholic, the one caused by alcohol, the one caused by infections. And specifically for that, we have viruses. And there are several viruses that can cause it. However, the very common ones is hepatitis B and C. Okay, there are others. Some are actually hereditary. When children are born, they may already have it. But these ones I'm talking about now are for adults. People that have suffered, there are rare causes. People that have iron overload, hemochromatosis can have it. People from copper too, wasting disease can also have it. But these are rare causes. However, the common ones are the ones that I have mentioned, which we advocate that people look out for.
Okay. All right, let's remember that the reason why we're talking about liver diseases is because on the 19th of April, what WHO decided to say, yes, let's always remember this day for World Liver Day. And like I did say earlier, it's an observance that in raising awareness about liver-related diseases and the importance of liver health. Now, we need to stay healthy in order for us to be able to live a good and better life. Now, remember, good health is overrated, so we should not toy with our health. If it's in eating balanced diet, in living good lifestyle, yes, and also exercising. Most times we always procrastinate about exercising. We say, okay, we'll wake up by 5 a.m. and just jog around the compound and all of that. Yes. Now let's talk about exercising. How important is it to our daily living?
Exercising goes beyond the liver now, even for those who are hypertensive.
Okay.
Regular exercise has a way of dropping the blood pressure. Of course, we advocate taking medications.
Yes, yes.
But, exercise has a way of positively affecting the liver, bringing down the cholesterol level. And, for those who have fatty liver, has a way of also helping to reduce the fatty content of the liver. So, of course, we cannot overemphasize the role of exercising. However, we need to exercise in such a way that we don't also cause harm to our bodies.
Yes.
So,
yes.
just like you said, you could advocate 10 to 15 minutes of regular daily, or at least 5 times a week. It might not be daily, but if you can spread it, average of 5 times a week, 10 to 15 minutes, exercise that could make you sweat.
Yes.
So with that, you don't over-labor yourself, and something that you can do on a regular basis.
Okay.
And over time, it will be beneficial.
All right, so your advice to everyone out there listening and watching us right now. So what's your advice to them?
The first thing is that those who have liver problem are one of us. They are amongst us. In fact, WHO actually shows statistics that 1/4 of the world's population today have chronic liver disease. If, of course, if the population of the world is 6 billion, it means that about 1.5 billion have chronic liver disease.
Yeah.
Out of this, 2 million persons die from liver disease every year. If we mention three cancers that kill people worldwide, cancer of the liver is one of the three. So it's actually a strong reason for us to come together and celebrate
World Liver Day. Yes, yes.
So it's something that we advocate. It's something that we know that it's beneficial to us because also the liver doesn't tell us on that there's something wrong with it.
Yeah.
It takes a long time, so it becomes chronic. You know, we have acute and chronic. It becomes chronic before most times people begin to notice those things, and they say, "We go and do ultrasound scan." Before we discover there's a problem.
Yes. So that brings to mind, or what you actually said, it's important to always go for checkup.
Yes.
At least once.
Average of once a year.
Once a year.
And once there's a problem, you must ensure that you see the specialist. Not just going to see any doctor. You say you want to
specialize in that field.
Yes.
All right. Thank you so much, Dr. Omo. We are definitely grateful for, coming down here to educate us more on World Liver Day. Take good care of yourself. Take good care of your health. It's definitely very, very important. To have seen you again, do have yourself a blessed day. Good health is wealth. Bye for now.